Hi guys, Dr. Paul Hodgson here, owner of New Wave Stress and Pain Relief, and today we're going to talk about migraines and maybe what sets our practice apart and our results apart from other practitioners. So if you talk to any practitioner who really is serious about treating migraines, they will tell you that migraines is one of the most difficult things to treat consistently. We all have successes under our belt, but every migraine patient is different and they respond to different stimuluses and different treatments. So one of the things that I like to teach my migraine patients is that their migraine treatment is going to be unique, and here's how we like to think about their migraines. So I like to introduce the concept of stress and the threshold of symptoms, and how we have three types of stress: chemical, mental, emotional, and physical. And those types of stress actually stack on top of one another. So if you were to search the internet or search the literature, you're going to find resolution of migraines with many different types of treatments: chiropractic care, cranial treatments, diet changes, medications, stress reduction techniques, and mental health things. You'll find all different kinds of treatments that are effective at migraines, and then you might have tried many of these yourself and they didn't work for you. So here's why that might be the case, and here's why there might be multiple treatments that can help you and multiple treatments that are necessary to help you truly solve your migraines for the long term. So these stresses stack. So having a chemical approach, or like going to the medical doctor maybe, or doing a diet change, eliminating possible probable foods, or going to a chiropractor who does exclusively structural work, or going to a therapist and kind of working on past traumas, unresolved traumas, irritating mental habits, that kind of thing. Any one of these could be significant and if we reduce the stress enough, we could get you below the line of symptoms. However, if we were to attack all three of them, we might get better results, and we might get you further away from this threshold line of symptoms where the migraines actually come on. So we like to do a detailed physical assessment, especially of the top bones in the neck and the function of the skull and the cerebral spinal fluid flow and that whole neurospinal system. We also like to take a deep dive into your chemistry. We like to sometimes look at your blood work, order a few tests, and then also consider what are you eating and what are you putting into your body, where's some toxic exposures potentially coming from. And then last but not least, we have to consider your mental emotional state, your stress. And this isn't, we don't generally address this by saying, well, I guess you just got to quit that job, or I guess you just got to get out of debt and then you won't have these migraines anymore. Sometimes we can't deal with the external stress at the moment. It's outside of our control. That's what makes it stressful. But what we can change is how you react to it, how you adapt to it, and how you're able to perform in spite of the stress going on. And we do that with a technique called neuro-emotional technique, and then we have some supportive things and supportive factors that go with that, helping your nervous system get out of the fight or flight, out of the trauma, and so that you can address the actual stress, the actual problem, from a state of ease and from a state of power and rationality.